Have you ever seen this in your newborn's eyes? Well, this is actually a blocked tear duct and is not necessarily infected. I'm Dr. Tracy Tyson. I'm a board certified general pediatrician, and a blocked tear duct or nasolacrimal duct is extremely common in children. Around 11% of newborns actually are born with a blockage in the tear duct, meaning that this little tiny hole right there is covered with a membrane so the tears can't come out. It gets blocked and it starts to make a lot of mucus and discharge. So it is usually not infected. It is usually just mechanical or like a plumbing issue. And over time, in that first year of life, that membrane will slowly start to go away and the tear duct will open up and more tears can come out. It's less likely to get irritated and have a lot of discharge like here. So here are some of the things that you can do to try to open up the tear duct if you notice this in your baby. So there's something called a Krigler technique, and you're actually going to take a clean finger and you're going to start right here at the base of where that tear duct is, and you're going to massage for 2 or 3 seconds. And then you're going to take your finger and draw it down along the bridge of the nose and back up and do it again. And you're going to do that for about 2 or 3 minutes twice a day. Sometimes you will notice a little bit of tears come out of the tear duct, and that lets you know that you're milking it out and you're getting somewhere. So we want you to do that twice a day when you start to notice either tearing or a little bit more mattering or discharge like in this baby. So this does not need to be treated with any kind of surgical procedure or antibiotics unless a few things happen. So if this persists after 9 months of age, or it's constantly getting infected, your pediatrician or primary care provider might refer you to an ophthalmologist sooner, and then they would do a little dilation where they probe that tear duct and open it up a little bit more. If it's only on one side, they can do that in the office. If it's in both sides, sometimes they take them to the operating room, but it just depends on the child. So it doesn't need to be treated surgically in that first 9 months of life unless it's constantly getting infected. So how do you know when to talk to your doctor about it? First of all, anytime you have questions or concerns, if you're not sure what this is, ask them, and they're going to notice it during the examination. But if you've been doing the massages for more than 3 to 4 days and you're not getting any resolution in that gunky discharge that's coming out, talk to your primary care provider. If the whites of the eyes are turning red, you're getting increasing amounts of discharge throughout the day, where every time you look, there's more and more discharge. That can be a sign of infection, and they might need a topical antibiotic, which is usually an ointment in young babies, sometimes a drop, and you still do that same massaging, you just do it with the antibiotic. So very common condition, up to 11% of newborns. It's common just as much in boys and girls, more common in Caucasian kiddos, usually goes away by 9 months of age. Rarely is there a complication. Doing that massaging twice a day and then following up with your primary care provider if it's worsening, if it's not improving after 3 to 4 days of doing massages, or if it's not getting better past 9 months of age. I hope this helps. Take care.